Turning to a new class of drugs we're going to be looking at here are drugs to treat infection with a specific focus on antibiotics. So antibiotics or antimicrobial agents or you'll hear some certain terminology that might get used kind of back and forth with these particular types of drugs, but largely known as antibiotics. We're looking specifically at drugs that directly affect bacterial infections. So to look at this, so antibiotics are used to treat bacterial infections. So probably one of the more widely administered drugs that we have. However, one thing we do find that we do have a tendency to, and this has been something that over years has kind of been a problem. A lot of antibiotic use is typically unnecessary, and a lot of times people kind of go to try to get antibiotics when the application's not really there. So, and for instance here is, many people when they get common viral infections, they look to go to the doctor to get an antibiotic because they think it'll help them get better faster, and it's simply not the case. Most, for instance, just to look at respiratory infections, most of your respiratory infections are caused by viruses. Even just pure sinusitis or sinus infections, many times people are quick to run and go and get an antibiotic right away. And even studies have shown that most sinus infections, even if they are, interestingly enough, even if there's a bacterial component, it doesn't tend to make them get better faster. It doesn't mean that you should never get an antibiotic if you have a sinus infection. It just means that many times the primary cause is actually a virus, and the antibiotic's actually not going to make it better any faster. Now, the problem with this, as is talked about, we've developed these multi-drug resistant organisms. So basically, we've developed these organisms that are now resistant to some common antibiotics. Now, there's still ways to treat them, but we end up with these drug resistant organisms. So MRSA is probably the one that we hear about the most in athletic training settings. So methicillin-resistant Staphylococcus aureus. There's also VRE or vancomycin-resistant Enterococcus, and then Pseudomonas aeruginosa. And so these are basically all strains of bacteria that are resistant to antibiotics. So again, just the ability to treat these tends to be a little bit more difficult because the typical antibiotic routine, if you will, won't be able to basically kill these organisms. So again, antibacterial drugs, they're a drug active against bacterial infections. So we're going to talk about two types of antibiotics. So if you've read in the chapter, which you should have prior to listening to this, bactericidal antibiotics kill the bacteria as opposed to bacteriostatic antibiotics, which slow the growth down. Okay, so there's two different mechanisms, and there's classes, there's types of antibiotics that are bactericidal. There's types of antibiotics that are bacteriostatic, and that's basically either way, you still are treating a bacterial infection, but it's just the mechanism at which you get it. Now, you have other types of drugs that treat infections, however, they're for other organisms, okay? So in the case of the flu, there's antiviral drugs that are very effective at limiting the flu virus, okay? You have your antifungals, which basically work with fungal infections, and then antiparasitics, which help with parasitic infections. So basically, your types of infections, as we even discussed in the pathology portion of this course, you have bacterial infections, viral infections, fungal infections, and parasitic infections. So the vast majority of what we're going to be talking about in this chapter looks at antibiotics, but these kind of represents some of the other types of medications used in treating different types of infections. So classification of bacteria. So when we're looking at kind of classifying bacteria, so again, bacterial infections are various. They could present as local infections. So what we typically see in like a lot of skin infections, for instance, present locally. So if you have a bacterial skin infection, like say an abscess, like that tends to be more of a local presentation, as opposed to systemic bacterial infections, and many times systemic bacterial infections result in fever. So that could kind of be affected based on the pathology. So, and then we look further at ways to classify bacteria. So we look at the morphology. That just looks at the shape of the bacteria. So we have, you know, again, just some examples. The shape could be spheres, rods, spirals, helixes. Again, and that could impact how the bacteria gets treated. We gram stain bacteria. So this is based on the properties of the cell wall. So this also could kind of tell us potentially what type of antibiotic we use to treat certain things. So for instance, gram-positive bacteria tend to be present in soft tissue infections, any infections of the heart, bone, pneumonia is typically a gram-positive. Strep throat is also a gram-positive bacteria. Your gram-negative bacteria tend to be present in urinary tract infections, infections in the bloodstream, and wound surgical sites. So this will sometimes kind of lead, so if you're wondering, well, why does a physician prescribe an antibiotic, you know, this type of antibiotic for this condition versus this? This is part of that. So the antibiotics that you will typically get prescribed, for instance, for like if you do have a bacterial infection at the heart, will be antibiotics that affect gram-positive antibiotics. Okay, encapsulation. So encapsulated bacteria are protected from phagocytes, which tends to make them, you know, it allows that to increase their virulence. So in other words, like if a bacteria has like kind of like an outer shell. So if you remember from talking in we discuss it in modalities, but phagocytes are those the white blood cells that come out and they kind of eliminate the debris or any type of foreign substance in the area. Well, you get the same thing in an immune response. However, in the case of something like this, it's a little harder. The infection is a little more aggressive. Because of the fact that that bacteria is protected with that encapsulation. And an example of that would be, again, a streptococcus infection with that type of infection. The oxygen requirement, so aerobic bacteria need oxygen to grow. Anaerobic bacteria, they kind of occur naturally. So anaerobic bacteria, they occur naturally. They don't tend to cause infection in general, but they can after trauma. Whereas aerobic bacteria require oxygen to grow. So again, that's kind of another classification. We look at bacteria, because again, in general, our body, we have bacteria in us all the time. We have some natural bacteria, for instance, like in our gastrointestinal tract, which is actually beneficial. Obviously, we don't want it to get too prominent because that could create issues, but you want kind of an optimal level when you're looking at that. But obviously, aerobic bacteria require oxygen to grow. Again, anaerobic do not require, however, they also will be present naturally in the body. So here's a figure from your textbook. Again, just kind of showing the different shapes and kind of some of the various classifications. There's another. I would encourage you to look at Figure 10.1 in your book as well. That figure kind of goes through the various areas of the body and the types of bacteria that are present. So I don't have a picture of that in this particular lecture, but it's something you could look at in the textbook. It kind of goes through all the different areas of the body, the different types of infections. So one, it's going to help you with the different types of infections, but it's also going to kind of make you familiar with the types of bacteria that also tend to be present and that tend to cause those particular infections. So here we look at the mechanism of action as to how antibiotics actually work. So again, really important point here. We kind of have a little illustration off to the side here that kind of emphasizes. So the most common mechanism we have right here is the inhibition of the cell wall synthesis. So obviously the cell wall will kind of encapsulate the bacteria. That's probably the most common type of mechanism of action. So, we have some examples of things that will actually do that and perform, and we'll talk about what type of antibiotics specifically do that. Another one you have is an inhibition of protein synthesis in the cell, and that's the second largest class. So that's another class of antibiotic that will work on that. Again, that's going to be your second largest. Then you can have alteration of cell membrane structure. So those are antibiotics that will specifically alter the structure of the cell membrane. Inhibition of nucleic acid synthesis. So again, those antibiotics will work via that mechanism, particularly on the inside of the cell. And then you have antibiotics that perform basically a mechanism to basically disrupt the metabolism of the cell, of the bacteria, basically causing it to be rendered ineffective. So another thing we kind of look at with this, so again, we kind of look at the mechanism of action. This picture further illustrates that. So if we look at the inhibition of cell wall synthesis, for example, beta-lactams are classes of antibiotics. Penicillin is a very common antibiotic. So you can see it showing here. This picture is just showing you like, okay, so here's your cell, basically, if you will. They're basically showing how they inhibit the cell wall synthesis. Alteration in the cell membrane structure with the glycopeptides. That's kind of how the arrow is kind of coming inward here. The anti-metabolic activity with the sulmonifieds, so on and so forth. So, for instance, inhibition of the nucleic acid synthesis. You see that with the fluoroquinolones kind of coming in here. So here, this is basically showing the nucleic acid synthesis. This little purple illustration here is kind of demonstrating that. So, and again, we're going to bring up these classes again later on, but this kind of gives you the initial mechanisms of actions. Again, the most common one of the, again, penicillins tend to be some of the more common antibiotics we use, and again, their mechanism is basically in inhibiting the cell wall. So one of the most important things in prescribing an antibiotic is understanding the spectrum of activity. So when a physician is going to prescribe an antibiotic, again, they're going to be looking at kind of like where the infection is and what the potential bacteria could be. So in the case of what are called broad spectrum antibiotics, so these are antimicrobials that will kill many different types of bacteria. So pretty much for the most part, like if you what they call empirically treat. So empirically treating is treating something that you effectively believe to be the cause of the infection with a broad spectrum antibiotic is likely going to basically destroy the pathogen. However, the problem with broad spectrum antibiotics is a lot of, again, that antimicrobial resistant pathogens. These are basically what are responsible for those developing. Okay, so that's why if you can identify the specific pathogen and then use the direct antibiotic for it, it tends to be better. That doesn't mean that all broad spectrum application of antibiotics is bad. It's far from the case, but that's where it comes from. So that's why it's really important, and that's why, again, it's vital to make sure that if you're going to treat something, try to figure out basically the best application for it. Narrow spectrum antibiotics. So this is where if you kind of know the specific bacteria and how, and just will tend to be a first line if you know what it is. Gram staining can help with that process. So for instance, if you've ever had strep throat and you had a throat culture done, that's basically your gram staining. So if you get a throat culture done, they then know what type of antibiotic should be used to treat that, and you get treatment for it, and you basically get better from it. Okay, so it's really important to note that too. Again, in cases where you can potentially inhibit the development of these antibiotic-resistant type of bacteria. So if you look at there's a list in your book kind of going through gram-positive bacteria and gram-negative bacteria. So, for instance, like gram-positive bacteria, again, and we talked about this a little bit already, tend to cause, like, for instance, skin infections. They tend to be responsible for a lot of heart valve infections, whereas gram-negative bacteria are typically responsible for, like, urinary tract infections or GI infections that cause diarrhea. So we gave a couple of those examples, but there's also another list. So make sure to take a look at that again. And so this kind of dictates what type of, again, this is another thing that will tell us what type of antibiotic should be getting prescribed for the individual patient. So examining the therapeutic effects, looking at various types of antibiotics. So we're going to classify them based upon the mechanism of action and their spectrum. So how they work, and then like as far as whether they're broad spectrum or they're narrow spectrum. So again, take some time, and whether you do it now, you pause the video, go and kind of look at the table. But I'm going to kind of be referencing this table as far as the different categories. So make sure to kind of do a little bit of a thorough review of this table in conjunction with the notes that I'm giving you now, because there could be some information within that would be beneficial. So first we have, as far as the mechanism of action, inhibiting cell wall synthesis. You have your, typically a very common antibiotic, your penicillin, your cephalosporins, and your carbapenems. They're all beta-lactam based antibiotics. So these are some very common antibiotics utilized. Penicillin is probably one of the most commonly prescribed antibiotics just in general. It treats a wide variety of things, treats skin infections, urinary tract infections, respiratory infections. There's a lot of different things that it tests for, or it treats rather. And again, take a look at some of the others. The cephalosporins and carbapenems are some of the most common ones too. So again, as you're kind of going through this, look at the spectrums that they, whether they're broad spectrum, narrow spectrum as well. You have those that inhibit protein synthesis, your macrolides, your tetracyclines, and your aminoglycosides. You have those that inhibit nucleic acid synthesis, that's your fluoroquinolones, nitromidazoles. Alteration of cell membranes, your glycopeptide, and your antimetabolic sulfonamide antibiotics. Those are your, sulfonamides are kind of interesting, just to kind of highlight something with them. They're your sulfa drugs, so you have to be careful. Certain individuals do have allergies to these sulfa drugs. So again, take a look at, look at that table 10.1, take some time with it, kind of be able to recognize some of the examples, the generic and trade names, and just being able to recognize, like I would say, being able to recognize, for instance, like ciprofloxacin, for instance, as a fluoroquinolone. So if you look at your fluoroquinolones, your ciprofloxacin, levofloxacin, ofloxacin, those are examples of fluoroquinolone. So being able to look at generic and trade names and recognizing what category they fall under, recognize what mechanism of action they fall under, those would be important things that I would expect and want you to know regarding the different types of antibiotics. So looking at routes of administration, again, and we've kind of all, probably every single person in class has taken some form of antibiotic before. Most antibiotics are prescribed and delivered via enteral route or via the gastrointestinal route in the form of pills, tablets, capsules, and liquids. So as long as they have a functioning gastrointestinal tract and they have they're stable, they have hemodynamic stability, you're typically going to be given an oral antibiotic. In some instances, however, for instance, the challenges with this, if someone has GI distress or poor absorption, there could be other routes as well. So IV route, so some antibiotics can be given via IV, and that's in the case of systemic infection or if they're critically ill. Those could certainly be situations where, in addition to GI distress, and if they're worried about absorption, that can certainly be a situation where IV antibiotics would be utilized. Here's kind of an interesting, a unique scenario: osteomyelitis or bone infection. So in kind of practice in sports medicine, osteomyelitis would be a situation that could possibly happen as a result of a compound fracture, where the fracture does pierce the skin and there's an open wound. In this instance, you would have to then get that. This would be another situation where IV antibiotics would be administered. So this particular infection is viable for a few weeks to several months. Vancomycin is going to be IV'd, is going to be administered via a PICC line. So a PICC line is a peripherally inserted central catheter, and that's going to allow the antibiotic to be administered to the central circulation. And they will, typically monitor C-reactive protein levels, which is just a marker of inflammation, and do follow-up images. So this is kind of a unique situation. They actually show a picture of this, what a PICC line is, if you've never seen one or heard of one. They do this anytime that they want to have easy access for a period of time to be able to administer any type of drug intravenously. So when we look at the pharmacokinetics, so again, absorption can be affected by many factors. So as a for instance, like diarrhea, or really anything involving the gastrointestinal tract. Again, we talk about how, again, most commonly we're going to administer these drugs via the enteral route, that if there is diarrhea or some type of issue with the gastrointestinal tract, that is certainly going to affect bioavailability. And again, the distribution will occur via binding to serum proteins, and that's just going to vary by the type of infection that we're trying to treat. It is going to be metabolized in the liver, and the steady state requires 5 to 7 half-lives if the dosage is less than 1 half-life. So basically approximately 5 to 7 half-lives are required for an antibacterial drug to reach steady state when multiple doses are given in a time frame shorter than the half-life itself. So that's why it's really important to make sure that when somebody is taking an antibiotic, that they take it consistently to make sure that it has its best effects. Okay, so looking at pharmacodynamics, so there's a couple ideas we want to look at here. So there's 4 factors that are related to the antibacterial efficacy of antibiotics. So again, now here we're looking at the effects of the drugs on the body, or more particularly here, looking at how the amounts of the drug will actually affect the efficacy and the antibacterial activity. So we have 4 factors. Now, I might go through these a little quick as I'm discussing them here. So again, this is where you might want to pause the video, reference your textbook if you're writing notes, or maybe just listen for now and maybe go back and kind of write these into your notes. So again, use some strategy here that can help you as you're going through these. So the minimal inhibitory concentration, that's our first factor right here. That's basically the lowest concentration of the drug that will inhibit the growth of microorganisms under standard lab conditions. So under standard laboratory conditions, that's the lowest concentration that'll inhibit the growth of microorganisms. Okay, the peak to minimal inhibitory concentration ratio, that's best correlated with antibacterial activity, and that's the ratio of the peak serum concentration, which you're looking at here. So that's the peak level of concentration of the drug in the body to the minimal inhibitory concentration, which is what you're seeing represented. So this is the minimal inhibitory concentration here. This is the time above minimal inhibitory concentration, which is what we're going to be looking at with the third factor. But getting back to this peak to MIC ratio, that's basically going to be, again, that's best correlated with antibacterial activity, and that's basically the magnitude at which peak concentration exceeds the MIC. The percentage of time above minimal minimal inhibitory concentrations, the duration of the dosing interval where the antibiotic concentration exceeds MIC. So that's strictly just the time frame that the peak concentrations above that level. And then the 24-hour area under the concentration time curve, that basically is going to be another ratio. They're going to put that to the minimal inhibitory concentration ratio, and that best correlates with antibacterial activity. So effectively, the best point in time of antibacterial activity is happening right in here. It's the area above the MIC and the peak serum concentration. Now, there are a couple other factors related to this. When you're looking at antibacterial activity and the drug that you're taking. So there's kind of three factors related to that. There's what we call concentration dependent activity. That's when there's higher drug concentrations associated with greater rate and extent of bacterial killing. Okay, so there's certain antibiotics that particularly relate back to that. Aminoglycosides, fluoroquinolones, metronidazoles are examples of antimicrobials that exhibit concentration-dependent activity. There's time-dependent activity. That's when the duration of the dosing interval where the antibiotic concentration exceeds the MIC and best correlates with antimicrobial activity. The best, your antibiotics that work best from a time-dependent standpoint are your beta-lactams, your erythromycin, and clarithromycin. They exhibit time-dependent bactericidal activity. Then there's the exposure-dependent activity. That's the amount of drug given relative to the AUC24 to MIC ratio and best correlates with that. Most antibiotics that have exposure-dependent antibacterial activity are best characterized by that particular one. That's your vancomycin, tetracycline, and clindamycin are ones of that. So those where your pharmacodynamics come in and some of those factors are involved. Like I said, take some time to just, again, review that one a little bit. This might be something where you want to organize that a little bit more particular in your notes. So a lot of what we talked about obviously is going to affect kind of like the timing. So if you kind of go back to that, whether that, an antibiotic's concentration dependent, time dependent, exposure dependent, and again, some of that will kind of be dictated by the type of infection they're dealing with. But when we're looking at dosing guidelines, there's a couple things to take into consideration. One is based on the urgency and illness severity. So again, depending upon how urgently it needs to be kind of administered. And one thing to make sure, and this is really important, and this is where, as an athletic trainer, you could certainly, again, assist. Again, part of our thing is to make sure that our patients, when they're given some sort of medication, that they know how to take it, and that's part of our competencies here. Make sure they take their full course. So even if symptoms have resolved, and this is actually still something that a lot of people have a tendency to still have issues with, in that a lot of people think, well, I'm better now, I could stop taking the medicine, and in those situations, they still need to take them. So they need to make sure that they're taking their full courses of antibiotics, even if their symptoms have resolved. That's a very important thing to make sure to educate our patients with. Adverse effects with antibiotics. So again, antibacterial medications are probably some of the most common things. Some side effects that are common and to be expected, one of them would be diarrhea. Diarrhea is a very common thing to have happen because, again, sometimes the antibiotics can have effects on the natural flora within the gastrointestinal tract. So they could basically kill some of the good bacteria that's in the gut, and that could then cause an individual to have diarrhea as they're taking the medication. Tendon injury is one, particularly with certain types. And this is probably one of the biggest ones to be aware of. So particularly ciprofloxacin, which is a fluoroquinolone, there's a connection between tendon issues with that. So that's something to be aware of. And again, ciprofloxacin is a fairly common antibiotic given for certain conditions. So for So for the athletic population, you have to be aware of tendon tears with that. Food-drug interactions are a common thing to look at as well. Again, going back to ciprofloxacin, you should not take ciprofloxacin with calcium-rich foods like dairy or antacids. So you want to make sure that individuals are aware of that. And sensitivity to sunlight is another thing to be aware of. Tetracyclines are big with that. So tetracyclines are commonly prescribed for certain pathologies, and sensitivity to sunlight could be something that an individual has issues with. So if someone is taking a tetracycline antibiotic, they should be very conscious about protecting themselves from a lot of heavy sunlight exposure. So looking at the indications and precautions. So again, antibiotics, again, we only want to make sure we're using them in scenarios where they're necessary. So again, getting away from the idea of, like, for instance, with upper respiratory infections caused by, for instance, viruses, not indicate it. But we want to make sure that there's criteria in place before we use them. So again, they're appropriate if they're going to speed recovery. So for instance, you have situations like, acne is certainly not a serious condition, but, in cases of severe acne, it's unlikely to clear in a good time frame without using antibiotics. In situations where an infection could spread, so again, impetigo, for instance, is a skin condition. It's not a serious skin condition, but there's also a good chance it can make it a lot easier to spread to others, or speed recovery or prevent more serious complications. Now, there are other scenarios where you still might use an antibiotic, but you do need to be more aware of particular concerns. So again, these aren't necessarily situations. They're actually situations where you could still use an antibiotic because you have to be concerned, but you want to make sure and monitor the patient. So anytime they're over 75 years old, a cardiac patient with heart failure, or diabetic using insulin, or any immunocompromised patients. So for instance, individuals with HIV or someone taking chemotherapy. So these individuals may get prescribed an antibiotic just because of the fact that they're more vulnerable to a bacterial infection, but you do have to be aware of potential negative effects with them possibly taking it. Obviously, one of the big things or contraindications or allergies related to antibiotics, particularly with penicillin. So there's, penicillin allergies are very common. You have these. So, immunologically mediated adverse reactions to beta-lactam antibiotics occur in up to 10% of patients receiving them. So an anaphylaxis can happen in 0.01%. So again, it is a fairly common thing for individuals with penicillin, which is a broad spectrum antibiotic, for there to be allergies related to that. So that's something that someone would want to definitely look at in a health history, to make sure that an individual does not have that type of adverse reaction. Okay, so now just kind of going through some of the different types of antibiotics. So your beta-lactams, again, these are going to be your very common broad spectrum antibiotics. Probably, again, some of the more commonly prescribed antibiotics you're going to find. Your penicillins, your carbapenems, and your cephalosporins, again, are some of them. Your adverse reactions that you commonly see with these, or common adverse effects you see with many different types of antibiotics. Your nausea, diarrhea, rash, urticaria. There's what we call the super infections that could possibly occur as a result of suppression of good bacteria in the body, and that would include a candidiasis infections. So again, allergies are another one that are very common with certain types of antibiotics. So again, it's important to be aware of that. And again, these are your broad spectrum. They're very highly effective. Carbapenems are actually one of the broadest drug classes available, so be aware of that. So again, as we're kind of going through these, being able to recognize what types of antibiotics fall in the various categories. So Looking at the macrolides, so the way to recognize them is at the end of them, you'll notice mycin at the end. These are among the most common prescriptions in the world. So again, these are fairly common to see getting prescribed. Most people that take them report some type of adverse effect. Most of the adverse effects are GI or gastrointestinal. So again, the diarrhea, the nausea, upset stomach. Azithromycin is probably one of the most easily absorbed with the fewest side effects. So that's going to be one of your more common one. Clarithromycin is another one that can be associated with that as well. So your tetracycline antibiotics, again, they are broad spectrum. So, and they are also bacteriostatic. So again, they don't necessarily kill the infectious agent. They're not bactericidal. They work by inhibiting bacterial growth. Okay. So again, they're only effective against microorganisms that are basically multiplying. So that's why they'll be used for specific, very specific conditions. Some complications that are unique, that are very common with tetracyclines. There's potential resistance. There's the what they call C. diff or C. difficile diarrhea. Photosensitivity is also very common with this. Some of your common tetracyclines here, vibramycin, doxycycline, minosin, and minocycline are some of your common tetracycline antibiotics. Your fluoroquinolones, which could be recognized with fluoxetine at the end of them. Again, these are very commonly prescribed. Cipro or ciprofloxacin was utilized as an antidote to anthrax, so it's kind of a unique thing. Again, probably the most common thing and what we need to be aware of, particularly with our physically active patients, is the unusual link to rupture among patients with Achilles tendonitis. So again, there is that. We did kind of talk about that the incidence of tendon rupture, and that is actually a black box warning on fluoroquinolone. So if someone does get prescribed a fluoroquinolone, so again, also again, be looking at the table in your book so you could kind of see some of the common things that these get prescribed for. But in situations where someone would be prescribed the fluoroquinolone, they would be, made aware of that as a potential adverse effect. So again, patient education, which again is a very important part, particularly what we will be doing to kind of support the patient in taking the antibiotic. Again, very common that individuals to get some gastrointestinal issues when they do take an antibiotic. So for instance, like with, I could just tell you right now with like Zithromax or Z-Pax, very common in the first day or two for people to get diarrhea with that because of the fact that, again, what you're essentially doing is the antibiotic is killing the functional bacteria in the gastrointestinal tract, which is going to cause the diarrhea. That's probably going to be, one of the more common things that an individual is going to experience. Again, extended release tablets need to be swallowed whole. Don't split or break them because, again, that's part of their, the extended release is particular to have that over time being able to be released so that they're effective. Dosages should not be skipped. That's really important. Photosensitivity with selected antibiotics, so particularly those tetracyclines. So tetracyclines are very commonly prescribed for individuals with acne. So people with like skin conditions, acne, rosacea is another thing where that's commonly prescribed. So again, those individuals would really want to limit their exposure to sunlight. Red flags that mandate contacting a provider. So tachycardia or abnormal heartbeat, any syncope, difficulty breathing, hearing or vision changes, and any type of dark urine, light colored stools, or jaundice. That would be indicative of basically an issue with the liver. So If there's some type of problem with the liver, the jaundice or the yellowing of the skin because of the buildup of bilirubin in the circulation. And again, that would also be indicated by the dark urine and the light colored stools in an individual where there'd be an issue with the liver. So we've talked a little bit about the adverse effects of antibiotics. So collateral damage refers to the development of resistance occurring in the patient's non-targeted antibacterial flora or their microbiome that could cause a secondary infection. So this is a situation where the antibiotic is basically having a negative effect on that kind of natural environment, particularly in the gastrointestinal tract. So the development of C. difficile is an example of that. So for instance, someone takes clindamycin that treats gram-positive bacteria, but it's resistant to what we call C. diff or C. difficile. And what could basically happen is that C. difficile could basically kind of overwhelm, if you will, the gastrointestinal tract and cause that secondary infection. Okay, so any antibiotic can possibly disturb the composition or the function of the flora and cause diarrhea. However, C. difficile is an infection that is a little bit more serious and then requires special treatment for. So if you have a patient with diarrhea and fever, also very dark bloody stools, those would be things that an individual would want to be referred to. Okay. Other antibiotics that can induce diarrhea, any type of ampicillin, amoxicillin, clavulanic, cefiximine, cephalosporins, fluoroquinolones, azithromycin, tetracyclines, any of these can induce diarrhea. Again, if somebody just has antibiotic-induced diarrhea, that's usually something that can resolve on its own over time. If someone has C. diff, they'll have the other symptoms. Again, in the case of C. diff, there's much greater abdominal pain, fever will be present, even possibly bloody stools with that. So in those situations, those individuals need to be referred because then specific medication will need to be administered to then treat the C. diff infection. So we also talked about the issues with antibiotic resistance. Again, with resistance, with broad spectrum, they're less effective and more toxic antibiotic. So again, there's issues with antibiotic resistance, and this is why physicians are very cognizant of when they do prescribe an antibiotic, making sure that it's necessary for the particular type of issue that they're looking to treat with it. So again, the cost, morbidity, and mortality associated with this is really been an issue, and even with some other types of infections that do develop as a result of that. Again, providers need to be more judicious and not just use for trivial conditions. So again, as a reminder, it does not work on viral infections. So people need to be aware of that. It's unlikely to speed healing. That's another thing. So people just think, well, I'll get an antibiotic, and that will, kind of fix the problem and make it go away faster. And many times it actually doesn't. So it's important to make sure you're aware of that. Again, clinician stewardship. So again, role of the AT in conjunction with the provider, and we always talk about this. So again, reinforce provider decision that antibiotics are not always needed. So a lot of times a patient's going to go to a physician and they're going to want an antibiotic, and if the physician doesn't deem it appropriate, they're basically going to tell them, look, this is just something that needs to be treated with palliative measures, maybe some other types of medications to help with symptoms. Educate patients on potential harms, and again, provide education material or information with that. So again, making sure that individuals are aware with that. And again, if an individual is prescribed an antibiotic, what do they need to be on the lookout for? So again, be aware of common adverse effects. So just another word on kind of like the antibiotic-induced diarrhea. So again, the diarrhea is common with it. So again, someone gets a Z-Pak, they might get diarrhea. However, being aware of the more serious reasons as to why antibiotic-induced diarrhea would occur, Again, one of them being the C. diff. So if they do have a, a high, a fever, if they have many watery stools with it, possibly with blood or pus, they start to show signs of dehydration, those individuals need to make sure that they get referred to for further treatment. So again, in summary, again, make sure you make appropriate referrals. So, again, if you do have a patient come to you, and again, we have competency in being able to assess individuals for non-orthopedic conditions. Many times, though, we'll be referring people. And again, don't be afraid to even tell your patients, look, you might not get in. Again, everybody gets, particular to upper respiratory infections, everybody wants an antibiotic because they think it'll make them better faster. Again, educate your patients on that. Again, best practices on pathogen and data. So again, reducing the risk of antibiotic resistant bacteria. Again, the potential harms of antibiotic treatment include this. So you want to make sure that, again, if an antibiotic is not needed, they're aware of that. Again, potential harms might include, this potential, side effects of antibiotics, so on and so forth. So make sure that those aren't doing that. Shorter prescriptions may be better than longer ones. Again, that would be something that would be based upon the type of antibiotic that is given. And again, prescribers should choose prescription duration based on the nature of infection and patient response. Make sure the patient takes the antibiotic, if they are prescribed one, through the entire course is very important. And make sure that they're aware of adverse effects. Make sure they're aware of adverse effects that are ones that they will work themselves through. Like, again, regular antibiotic-induced diarrhea is something that can resolve on its own. However, if they're starting to show other symptoms, other signs or symptoms related to that, that's going to require potential that will require further referral. And these are the objectives for this particular chapter.